Hello, I'm Buck Black. I'm a therapist in Lafayette, Indiana. Hello to the Purdue nursing students out there. Let's talk a little bit about substance abuse. People often ask, what is substance abuse? And there's many different definitions as you talk to people in society, and then you look on the clinical side, then that's a whole nother thing. So I think the most practical definition of substance abuse would be if it causes a problem, then it is a problem. So if someone drinks a little bit on the weekends and it doesn't cause any problem at all, then that wouldn't be substance abuse. But if a person, let's say that they drink a little bit on the weekend and it's a little bit too much, and then they get a DUI, let's say that they hit .08, so they're just right there at the limit. Now all of a sudden they have a legal problem, so that would be in the substance abuse category. You can also look at the substance abuse as it doesn't cause any kind of legal problems, and everybody says, okay, well, it's not an issue at all. But later on, as time goes on, you end up having a health problem. So years later, let's say that you have a liver condition, that would be more on the extreme side, but let's say something a little more benign. So maybe that would be like stomach ulcers as a result, something like that. Then, well, that would be substance abuse, and that would be no legal problems, but nonetheless, you have a health problem as a result. Another way that I see people getting themselves in trouble with some kind of a drug is loss of relationships. So you might not have any health problems, you might not have any legal problems, but nonetheless, you get into arguments with your significant other on a pretty regular basis. So yet again, that would be a substance abuse problem, and the person abusing that substance may see it that way, and they may not. So that's something to look at as well. So there is a difference between substance abuse and substance dependence. Substance dependence means that you cannot quit using that substance. So if you can't quit using that substance, essentially you depend on it. That's how you would look at that. And in order to have dependence, that means that you would have withdrawal as a result. So if we would pick alcohol, for example, let's say that you use alcohol and you are dependent on it, so you use it regularly, and when you try to stop, then you have some kind of inability to do so. So on the extreme case would be the withdrawal would be the DTs, so the delirium tremens. And what that means is that you would shake a good bit. You might have hallucinations as a result, sweats and that kind of thing. And that in the extreme case, that could throw you into a seizure, and you could possibly die as a result. So if a person is going through the DTs, they need to get some medical help. They need to go to the emergency room. They need to go through a detox program to make sure that this isn't deadly for them. If a person is using opiates, a type of withdrawal from that looks more like flu-like symptoms as a result, usually goes on for about 3 days or so. So that would be physical for that. And it is a bit controversial about marijuana having a withdrawal effect. It does in some people. I've talked with plenty of clients who have gone through withdrawals from marijuana, and they're really quite minor. And if you don't realize what they are, then you might have it not even recognize it. So as far as having night sweats, difficulty sleeping, irritability, that kind of thing, it's nothing that is major. It's nothing that is deadly or anything like that. Just probably more inconvenient. The other piece of withdrawal could be psychological. So maybe your body doesn't go through these physical withdrawals, but nonetheless, your body goes through, or psychologically, you go through, I'm craving the drug, I feel like I need it, I feel like I can't function without it, and that kind of thing. So sometimes people just simply use these drugs in order to feel better, to feel calmer as a result. And maybe it's, I can't go into this social situation because I have all this anxiety. And if I don't turn to alcohol, weed, pain pills, whatever it might be, a benzo, then I feel like I can't go through with the event. So that would be the psychological side. So in order to have dependence, you don't necessarily have to have all those physical traits, but you're probably going to have some psychological traits. Most likely you're going to have both. It just depends on the person. So that's the idea of substance abuse. It's amazing how common this is. So I would say that in my therapy practice, probably around half of my clients have a substance abuse issue of some degree. So they might be coming in for anxiety, depression, relationship problems, work problems. Those are the common ones. And when you listen more about what's going on, often a person is either using some kind of drug to cope and to try to make it through and feel better about themselves or keep their stress and anxiety down. Or maybe it is they primarily started with the substance and they started using it so much that they developed an anxiety or a depression condition. So usually we would say that it's a comorbid condition. So comorbidity, you guys probably already know this, having two conditions at the same time. So if a person has depression or anxiety, for example, it's common that a person, or especially bipolar disorder, it's common that a person will then have a substance use at the same time. So they occur together. It's not necessarily one causes the other, it's just a package deal. For other people, the depression, the anxiety, bipolar started first, and then they had the anxiety situation, or the substance use situation, I mean, or vice versa. So there's many different ways that this happens, but nonetheless, we have to pay attention to it, and it's so common that both things are going on here at the same time. So drugs are everywhere. And if you think about it, alcohol is a drug. Anything that alters your mood is a drug. And alcohol is extremely socially acceptable, especially on a college campus. And you know what? People often look at it as no big deal. But nonetheless, as time goes on, so many times people's drinking will increase little by little by little. And then before you know it, you have problems on your hands. So it's a lot of drugs that are a lot less socially acceptable, maybe heroin or meth, something like that. And we only think of that as being substance abuse. There's plenty of people in that category, and that's not the case. I mean, that's just simply one type. Sometimes people graduate from starting out with more of the what society says is minor drugs. And in my training as a therapist, I've always been taught not to call any of the drugs minor and the other drugs major, because you can get yourself into trouble with that. But nonetheless, you start off with alcohol, you start off with pot, whatever, and then people will often progress, to what society deems as worse and worse drugs, and then you end up, doing pain pills and doing heroin as a result, and it gets worse from there. So another thing that I want to mention is that addiction is a progressive disease. So kind of like what I talked about is that you start off with something more benign, let's say alcohol. And really, we could even say cigarettes, because there's discussion about how many people view cigarettes as the gateway drug. So you start off with one substance, and then it progresses. But we have to look at age as well, because so many times with when someone starts abusing a substance, they are a teenager is when it starts, because addiction issues usually start when you're young, and then it progresses through adulthood. So if you take the average person let's say that they're alcoholic, or they're addicted to pain pills, they probably didn't start when they were 40 years old. They probably started when they were a teenager or college age, somewhere in that vicinity. And then they used more and more and more, maybe adding more and more drugs as time went on. So that's something that that we need to know and that we need to pay attention to. So when we look at people in regards to the ones who they don't have a history of any kind of substance abuse as a teenager or early into adulthood, the second subset are the ones who become addicted to pain pills later in life because of an injury. And that's all in all more common as time goes on. And the most abused drug out there right now, the class, would be prescription drugs. So I'm talking about any kind of pain pills. So Vicodin, especially Percocet, any of those pain pills. And you might be any age, but you might be 40, 50, 60 years old. It might be later in life. Let's say that you break your leg, you're prescribed Vicodin, real common prescription to help with the pain. And before you know it, you say, okay, well, this feels really good. This really helps. And it's helping to lower my anxiety, my stress about life. It just feels so much better. And then before you know it, you actually get hooked on this. So that's something that we see happen commonly. And it's really unfortunate. And the medical community is working to decrease the amount of pain pill prescriptions, and then also just to pay attention to, not giving the patient a lot of refills, limiting the amount so it only treats their pain. So that's another type of substance abuse that happens, and it turns into dependence, and lives become ruined as a result. And I have plenty of clients that, they don't fit the stereotypes at all of what someone would think of as a drug addict. But nonetheless, through their doctor, and completely legal, you break your leg, you go to the doctor, you get a prescription, you go to the pharmacy, get it filled. The insurance company pays for it. So maybe you paid nothing for this, or you only paid a few dollars copay. And then before you know it, time goes on, the medication, it works, it helps too much, and you build a tolerance to it, so you take more, and then you feel that you can't stop using. So I have plenty of clients who they will end up doctor shopping, so going to different doctors to get more of that Vicodin prescription, for example. And they go down the line there, and they might get caught, and then as a result they're court ordered to see me. Maybe their family views this as a problem, or they view this as a problem themselves, and then they get some help, decide that they need to get help for it. So that's something that happens all too often, and we need to be very aware of that. So I think that, just as far as defining just what is substance abuse, I mean, we could talk about that forever, but those are some common characteristics. And I mean, I've failed to mention other types of substances that can be abused, such as any kind of over-the-counter drugs, especially like cough syrup, that's really common, and household cleaners. And anything that gives off fumes, people can inhale it and get high, and that's commonly more of what teenagers do, but nonetheless anybody can do that as well. So many different types of substances that people abuse, and sometimes it's because they have a genetic background that they're predisposed to addiction. Other times the person is really stressed out, they find something that makes them feel better, and then they run away with that, and it helps in the short run, but it causes problems as time goes on. And don't forget that there's other things that people can abuse that are not substances. So as far as gambling, sex, shopping, any kind of behavior, maybe it's food, it doesn't necessarily have to be a drug, just anything that a person gets carried away with. So I think that's something else that we have to pay attention. And it's all about the mood change, because we feel bad, we do the substance or the behavior, and then we feel better, but there is a price to pay for that feeling better. So that is when people then get themselves into trouble, they lose relationships, they lose jobs, they lose their health, various other things. Just remember that a person doesn't usually lose their job until it becomes quite bad, because everything else tends to go before the job. And if you think about it just kind of from a common sense perspective, if a person is abusing some kind of substance, well, you have to have an income. So you do everything you can to maintain that job so you can function. And most people remain functional, and it's only at the end stages of addiction that a person actually loses their job. So I hope that this helps with the definition of substance abuse.